Hi there. Today I'm going to walk you through what it looks like to have a planned cesarean delivery. Knowing in advance that you will have a planned cesarean can alleviate a lot of the stress around the unpredictability of labor. There are many reasons why you may have opted for this, including having had one in a previous birth, you're expecting multiples, your baby is large and your pelvis is small, your baby is breech or transverse, you have placenta issues, or a previous medical condition where it is healthier for baby to be born via cesarean, like an active herpes outbreak maybe. Some women simply choose it and their doctor agrees after counseling them. Your obstetrician will set a date for you to come in, and usually they block it for first thing in the morning as they want you to have an empty stomach. You will go straight into the labor and delivery department to be admitted. Once there, you'll sign consent papers after going over all of the risks. You'll change into a hospital gown. Your partner will change into scrubs. Usually you need to remove all of your jewelry, and you'll have to notify the staff of any dental appliances or contact lenses that you might be wearing. An IV will be started, and your vital statistics and the baby's heart rate will be recorded for a while. Sometimes you will have to wait much longer than anticipated if the operatings are being used for emergency patients. In some cases, I've even heard of people being bumped to the next day. Once the operating room is clear, you will be brought in, usually walking yourself, and your partner will wait outside to be called in after the spinal is in place. So the anesthesiologist will place some medicine into your spinal fluid with a needle, and this will numb you from about your breast down. Once you're laying down, often your arms are strapped out to your sides on the table. A blood pressure cuff is attached, and a little pulse oxygen measurement tool is attached to the end of your finger. Your abdomen will be washed. The top of your pubic hair may be trimmed or shaved, and then your abdomen will be cleaned with antiseptic and covered with sterile drapes. Usually a drape is placed vertically, very near your breast line, which blocks your view of the procedure. The obstetrician will begin the incision, usually quite low down, horizontally near your bikini line. And as long as you don't feel anything and they've made sure that your spinal is working well, that is when your partner is invited to come in and sit right near your head. The anesthesiologist also stays near your head. They monitor all of your vital signs. They make sure you're not feeling any pain, and often they'll describe to you what's going on the other side of the drape. Usually there's 2 physicians that are working on you with 1 or 2 nurses assisting them. Often there's 2 neonatal specialists that wait at the warmer nearby, and another nurse often floats around and helps as needed. The operating room is a really busy place. Once the doctors have cut through the skin and abdomen, they make an incision in the uterus. Now usually this goes in the same line as your skin incision, but sometimes not, just depending on the placement of the placenta and what position your baby is in. The baby is lifted out through the incision, but often they make as small an incision as possible, so there's a lot of pressure and tugging felt as they try to move the baby out, and sometimes that makes it feel very heavy on your chest and difficult to breathe. But the anesthesiologist is making sure that you have enough oxygen and will help to keep you calm, as well as your partner. The umbilical cord is cut right away, and the nurse takes the baby to the neonatal team. If baby is stable, often the partner is invited right away to see them. The doctor will continue on with removing the placenta and then closing the incisions with dissolvable stitches. The outer layer of skin is stapled closed, and these are removed a few days later, usually by the public health nurse or maybe at a visit to your doctor's office. At this point in time, usually if the baby's stable, your partner will come and bring the baby over and kind of hold baby near you and help support you to hold baby. And at this time, your incision's being repaired and there's still all this other business going on. Once everything is all cleaned up, you're both stable, you'll be moved to another bed and wheeled over to the recovery unit. Here your vitals are monitored for a couple of hours, and often special pressure cuffs are put on your legs for improved circulation. Usually you'll be able to hold baby skin to skin here and initiate breastfeeding. Afterwards, you will move to a postpartum room where you will stay for a few days. If baby is not well after birth, the baby may be taken out to the NICU, the intensive care unit, but usually your partner goes along with the baby. Then once baby is stabilized, you'll be reunited, and that could either be at the recovery unit or in your postpartum room. Sometimes baby must stay longer than you, but you can come and visit the baby every day in the NICU. And if you develop surgery complications, baby will stay in hospital as long as you do. Be sure to plan in advance for recovery at home with limited stairs, minimal lifting, and lots of support with cooking, cleaning, and taking care of baby. Hiring a postpartum doula would be immensely beneficial to make your recovery nice and smooth.